My name's Mark Hake. I'm an orthopedic trauma surgeon. I work in Ann Arbor, Michigan. Do exclusively orthopedic trauma. I've been in practice for a little over 10 years. The reusable depth gauge that's decades old does a pretty good job, but the fact that it hasn't really seen any new design or improvement over such a long period of time, I think is problematic. The bioburden issue with the depth gauges is a big problem, and it's pervasive in every hospital I've worked in. It's very difficult for the people who are cleaning, hundreds or thousands of instruments to clean every nook and cranny that exists within the reusable depth gauge. In working with trainees, people who aren't as experienced have really significant problems from time to time if that tip is bent and how to manage that situation. The depth gauge being put back together in a way where there's missing parts so that the measurement was significantly off. The edge depth gauge has really solved almost all of those problems, I would say. Every aspect of the device has been designed and thought out from a surgeon's perspective in order to fix the problems that we see on a daily basis taking care of our patients. The dynamic calibration is going to be something that is going to make the depth gauge even more useful. We're presented with a lot of situations where we need to change that during the surgery, or we have a specific calibration that we like to use in a certain area. And so the ability to change that and calibrate the device to our needs, I think will make results even better. All the other tools that we use, we see that attention to detail, the thoughtfulness in engineering a tool that is going to make outcomes better, make the surgery easier to do. The edge depth gauge, I think, fits right in with that. With all the improvements to the edge depth gauge, to the hospital, to the patient, to the surgeon, it just makes sense.